Hello everyone, I am Dr. Sunil Patil, consultant urologist and andrologist at Athayu Uro Care Center, Thane. Today I am going to show you how a urodynamic study test is done, as well as give a brief information about why it is done and how it is done. So urodynamic study test is required for a detailed evaluation of urinary tract, which includes lower urinary tract specifically, which includes urinary bladder as well as the urethra and urinary bladder outflow. So there are many diseases which include the bladder, urinary bladder as well as the outflow unit complex, which affects either males or females. These include urinary voiding problems like urinary urgency, frequency, urinary intermittency. You have to strain to void urine, or even after passing urine, the urine is not getting emptied completely. These problems usually have an initial evaluation protocol, which includes basic tests, ultrasonography and basic first line management with medicines. Even after all this evaluation, if the diagnosis is not clear or if the patient is not responding to medications, they are usually referred for further evaluation with urodynamic study. Urodynamic study test gives a accurate and a detailed evaluation about the status of urinary bladder and the urinary bladder outlet. As in, patient has to come, do the test and go home immediately. It is a 45-minute procedure. The test usually requires a prescription from a doctor who refers him for the further evaluation. Before doing the test, urine culture test is mandatory to rule out any pre-existing urinary infection and to treat it accordingly before doing the test. The test usually involves inserting very tiny catheters into the urethra and the rectum, and after that the patient is seated on a chair, after which the test is done in two parts. The first part, what we call filling cystometry, in which the bladder is usually slowly filled with saline solution, so that as the bladder fills, we study the behavior of the bladder as well as the bladder pressures generated inside it, and as the bladder becomes full, ultimately patient has a strong urge to void urine, after which he is asked to void urine. Then the next phase of the test starts, which we call uroflowmetry. As the patient is asked to pass urine, we again study the behavior of the bladder as well as the bladder outlet, and which includes studying the pressure generated during the voiding as well as the behavior of the bladder outlet, which includes sphincters which control the urine flow. That is also captured using electromyography electrodes. So this gives a detailed picture of how the patient is voiding, what happens during voiding, whether the bladder is generating pressures adequately or the bladder is underactive, or during voiding the outflow is not behaving properly, as in it is very hyperactive or it is underactive. This guides for further evaluation and further management as well as further surgical intervention. So when the test is usually done, the patients with voiding dysfunction are treated with medical management, and if the medical management is not working and the patient needs further evaluation or further therapy, which includes some other invasive therapy as well as some surgical intervention. So before doing those therapies, we need to have a urodynamic study test done for detailed evaluation of the urinary tract. In some patients, even after the initial evaluation, the differential diagnosis is not very clear. There may be confusion between two or more differential diagnoses. To differentiate between those, we need to have a urodynamic study test done. Also, in some patients, if there is a prior history of some surgical intervention and which has not worked, basically which has failed, like in a patient with prostatomegaly where the prostate surgery has been done but still the prostate surgery has not worked and we need to evaluate further. This is one example of urodynamic study test. Also, patients with stress urinary incontinence in females where the surgery has not worked and we need detailed evaluation why it has not worked. In those patients specifically, we need urodynamic study test. So when this study should be done, it is usually done as per the discretion of the doctor. When the doctor has done initial evaluation and he needs the further evaluation to be done for further treatment, we at Athayu Uro Care Center have state-of-the-art urodynamic study machine, which includes filling cystometry, uroflowmetry and electromyography study, and we also have the expertise and experience to carry out the test and to interpret the test accurately for the benefit of the patient. Thank you.